Aging Well Senior Health Advisories deliver important information to educate and support seniors about the importance of preventive health, making and keeping doctor appointments, prescription medicines, and good nutrition to prevent obesity and reduce risk of disease. Aging Well with Your Doctor.
I'm a strong advocate for people understanding their own bodies, knowing what's going on, and being active partners with their healthcare provider in taking care of themselves. So I think it's really important that people learn as much as they can. If they've developed a condition, diabetes or cancer, whatever it may be, I think people ought to learn about it. And they should learn what they can do to help themselves either stay well or heal as quickly as possible.
I get complete or annual physical, and then I have a blood pressure problem that we've addressed, controlled, and we check that every 3 to 4 months. Fortunately, I'm stable, follow my doctor's advice.
All patients should have a primary care physician. In some cases, a patient may also be seeing a specialist for a procedure or treatment.
Well, the primary care physician is sort of like the quarterback. They're directing everything. But sometimes a specialist will be called in to deal with a particular problem that the primary care doctor is either not able to do in terms of a procedure or doesn't know as much about as a specialist will know. So it's important that the specialist, when he or she sees the patient, gets back to the primary care physician and all of them are communicating.
So what's most important is that the primary care doctor and each one of those specialists is corresponding with each other, so that if there is a change in medication or if there is a change in diagnosis or an abnormal lab test that comes back, everyone knows exactly what just happened with that patient's history. And it's also very important that the patient keep the other doctors up to date. Maybe the note didn't arrive in time and the patient comes in for a follow-up visit. So the patient should also keep a list of changes that have been made and tell all their doctors.
Clear and concise communication between the physicians and the patient are very important to ensure quality medical care.
One question that often arises, are there things a patient should do to prepare for a doctor's appointment?
You know, when a patient comes into my office, I'd love to have a short list of the problems that they have. A lot of patients get out of the office and they also say, gosh, I forgot, I should have talked to them about the sore elbow or something. It's nice if they can have a short list of the things that they want to talk about, questions that they want to ask. It's also helpful for them to either bring in an accurate list of their medications or to actually bring in a bag of their medications. So the doctor can go over that and make sure that the decisions he or she makes is based upon an accurate idea of what their medication is. So it's important they bring in their list of medications, bring in their questions, and bring in any list that they have of the problems they want to address.
So the next time you visit your physician, it's important to do a couple things. One would be to take a list of your medications written out, and the other would be actually to bring the pill bottles with you. Make sure that you inform your physician of any medications that are given to you by other physicians, along with any over-the-counter medications, such as medications for cough, colds, or eye drops.
What's really nice and what I appreciate is when people have put some time into it before they come to the office and they come up with some questions that they have. And if they haven't, when they get to the office, we actually give them a form and say, what are the top 3 things that you're here about today? And have them write down those complaints and organize their thoughts. Then I can look at that before I come in the room and I can kind of know what their concerns are, and we can address those issues, and it just makes the appointment more efficient for they and for myself, so we make sure we get everything covered.
Medicare eligibles can educate themselves about medical issues and use this education to ask appropriate questions.
If you have diabetes, you should look into your health plan to see whether education such as dietary counseling, group classes are available. They're extremely helpful in terms of managing your diabetes and also understand a little bit more about the condition.
Skipping appointments is not uncommon. People often question the value of seeing a physician's assistant or nurse. Sometimes missing appointments is unavoidable, but more often there are ways to get to the doctor and back home that you may not have thought of.
Transportation to your doctor's office requires planning. Oftentimes that means getting the local paratransit service to participate in your transportation, and also working with your family is very important. Your neighbors can be a great ally for you in terms of able to take you from your house to your doctor as well. Knowing all your options are the key.
If people will plan, Dial-A-Ride or some of the DART services can work for them. A lot of my seniors will just plan appointments on the days that one of their children's off that can bring them in, and that can work. Catholic Community Services will give rides up where I'm at in North Snohomish County. For some of the people who are like out at Warm Beach, they have drivers that are available to take people to appointments. And so it takes a network of a lot of different things. A lot of the offices, and I mentioned we have a kind of a senior resource with our palliative nurse. We have a social worker who can help as well with people who have those issues, can help them solve some of their transportation issues. But it is difficult. I still have a few that do ride the bus, but a lot of the seniors now usually come in with either a Dial-A-Ride or with a family member if they can't drive themselves.
Transportation to the clinic can be difficult for some patients. I encourage you to discuss the issue with your primary care doctor or with your plan administrators to see if you have covered transportation.
Absolutely. There are many Medicare Advantage plans that offers different types of transportation services. It is important to check into your plan to see what sort of services they offer, and often you might benefit greatly from it.
The Aging Well Senior Health Advisory is produced by Seattle Community College's television in cooperation with Public Health, Seattle and King County, Snohomish Health District, Essence Healthcare and its participating hospitals and medical centers in Washington, the Polyclinic and the Everett Clinic.